So coming to the hearing aids. So in second year you have the topic hearing loss, and in that under that topic you might be studied hearing aids, what are the types, etc. The same thing, it is like a rewind or revision. So you can read that note also. So a hearing aid is an electroacoustic body worn apparatus which typically fits in or behind the ear and is designed to amplify as well as modulate the sound. So hearing aids consist of the parts of hearing aids. It's not necessary to study these things, but I just kept. So a microphone is there, an amplifier, a battery, as well as a receiver. So microphone to receive the sound waves from the air. So amplifier to increase the strength of the sound. A battery to keep this device functioning. A receiver, or it is termed as a loudspeaker, to change the electrical signals back to the sound waves. So these are the parts of hearing aids. So there are types of hearing aids. So micro CIC, CIC means completely in the canal. ITC in the canal. HS half shell. ITE in the ear. BTE behind the ear. So these are the types, main types of hearing aids. So you can see CIC completely in the canal. So in the canal, ITC, half shell, in the ear, ITE, and BTE, behind the ear. The main device is behind the ear. So adjusting with hearing aids. So the nurse should explain the uses of it in detail. The patient must adjust the voices and household sounds. So sometimes all the sounds will be amplified by the device. So we have to explain each and thing. You will be hearing sounds like this. Every sounds will be equal. So how to control this and all we should explain to the patient. So experiment by increasing and decreasing the volume self. So if the patient is adjusted to the background noise, the patient is ready to go for a small party where several people talk simultaneously. So after placing this hearing aid, we cannot send the person to a group of person, because the background sounds, and if so many people talk together, it will be very irritating to the person. So we have to make sure that the person is adhere to this device. So after adapting to controlled situations, the patient can encounter environments such as shopping mall, etc. So care of a hearing aid. What all care we should do? So when the hearing aid is not being worn, it should be kept in a dry, cool area. So the battery should be disconnected or removed when we are not using. The battery life is 1 to 4 weeks. So that should be mentioned, and the caregiver should know the life of the battery. So wash the ear mold frequently with mild soap as well as water. We should not wash the hearing aid. Okay. Only the mold should be washed. Toothpicks and pipe cleaners may be used to clear a clogged ear tip. Sometimes in old age we can see increased secretion of this liquid type of wax or cerumen. So it can stick to this mold and it can block the signals. So turn the hearing aid off when not in use. So keep an extra battery in case of emergency. Do not wear ear aid if an ear infection is present. So these all things should be taken care of or informed to the person. So if the hearing aid fails to work, what we should do? Check the on or off switch. Inspect the ear mold for cleanliness. Examine the battery for correct insertion. Change the battery if needed. Check for any break in the aid. So this all should be done if the hearing aid fails to work. Besides those hearing aids, there are implantable hearing devices, cochlear implants as well as bone conduction devices. So coming to the cochlear implant devices, these are used in people with severe profound deafness. So here the device does not allow the person to hear the speech, but creates an awareness of sounds such as doorbells or telephones. So that means the cochlear implants are used in patients with severe profound deafness. That much is needed. Only this line as well as this line. So bone conduction devices, it transmits sound through the skull to the inner ear, surgically implanted, similarly like cochlear implantation. Surgically implanted titanium screw implanted under the skin into the skull behind the ear. Once it heals, it is loaded with a vibrating hearing aid. So more severe profound hearing loss, only we are using cochlear implant device as well as bone conduction devices. So besides that, if you are not using this hearing aids, we can go for oral rehabilitation. So if hearing loss is irreversible, we can go for oral rehabilitation like auditory training, speech reading, speech training, sign language, etc. Speech reading means it is also called as lip reading. So it will help to increase the communication skills. Sometimes an old age person with hearing aid need this speech reading. So the person is able to use visual cues associated with the speech, such as gestures, facial expression to clarify the spoken message. So അങ്ങോട്ട് പോകൂ എന്ന് പറയുമ്പോൾ നമ്മൾ കൈ കാട്ടിയിട്ട് അങ്ങോട്ട് പോകൂ എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ അവർക്ക് gestures as well as facial expression we can use. So in speech reading, several words will look alike. For example, man as well as woman, while speaking, speech reading can leads to misunderstanding. So the nurse should help the patient to use by using and teaching verbal as well as non-verbal communication techniques. So we can use verbal as well as non-verbal communication techniques. So what are they? Non-verbal aids. These all things are very easy. Okay, draw attention with hands and hand movements. We can use hand movements. Have the speaker's face in good light. We have to use good light. Avoid covering mouth or face with hands while we talk. Avoid chewing, eating, smoking while talking. So when we talk with a patient who is having less hearing ability, do not eat, smoke, or talk in between. Maintain eye contact always. Avoid distracting environment. Avoid careless expressions. Use touch. Move close to better ear. So avoid careless expression. എത്ര പറഞ്ഞിട്ട് മനസ്സിലാവുന്നില്ല. അപ്പം നമ്മുടെ ഫേഷ്യൽ എക്സ്പ്രഷൻ അറിയാതെ മാറിപ്പോകും. അങ്ങനെയുള്ള എക്സ്പ്രഷൻസ് മാറിപ്പോകും ഉണ്ടാവരുത്. Verbal aids. Speak normally as well as slowly. അയാൾക്ക് ചെവി കേൾക്കില്ല എന്നാൽ ഒച്ചത്തിൽ സംസാരിച്ചേക്കാന്ന് വിചാരിച്ച് ഭയങ്കര ഒച്ചത്തിൽ സംസാരിക്കുമ്പോൾ അത് ഒരു നല്ലൊരു പ്രവൃത്തിയല്ല. So do not over exaggerate facial expression. Use simple sentences. Write name or difficult word if the person is not getting. Avoid shouting. All those things should be kept in mind. Keep in mind. So sign language also can be used. Sign language is used as a form of communication for deaf people. So it is a visual spatial language that involves gestures and facial features such as eyebrow motion and lip movements. But these are not universally accepted. Now Bluetooth as well as wireless accessories are also available. So this will allow users to connect hearing instruments directly to the peripheral accessories such as home, television, signaling devices like doorbells and all. So that is all about hearing aids. So we have studied dentures as well as hearing aids. Thank you so much.